I would like to tell a story, a real story of a real client. Actually, it's Gary's, the practice that Gary used to own, Life Smiles. And they really built a very strong oral conscious sedation practice. And of course, as their marketing partner, helping them get the right kind of patients, patients who are not on PPO plans, we focused on it. And the way we did it is, we looked at 10 different types of high value services they are keen on. And then oral conscious sedation was at the top of the list. And we really, really focused on like picking 30, 40 different keywords and phrases and going after it. Of course, to make a long story short, as you know, half the people in the US do not go to a dentist regularly. And most of them, actually, half of them don't even have a PPO plan that they can use. So, of course, they don't go there either because they're afraid of the bill, or they don't go there because they're afraid of the pain. Regardless of their reason, when they don't go there, and finally when they do, oral conscious sedation helps do a lot of work all at once, and of course help them overcome the fear of pain, etc., and then become great patients. So it's a great gateway service. It's a great high value service. And in today's episode, we're going to talk about how can you go about building that, both from a who is the ideal patient, how do you find them, and all the way to how do you deliver this very high quality, high value service.
Yeah, I'm excited about this series. If you're a regular listener to the Less Insurance Dependence podcast, you know that in our 6 steps to successfully resign from PPO plans, step number 6 is add high value services. Now, how do you go about determining which high value services to add? And I believe that's a very personal decision. Pick the things that you like. Pick what you like to do. So there isn't necessarily a generic menu of high value services, but pick the things that you enjoy. If you're someone who enjoys doing cosmetic dentistry, then cosmetic dentistry can be a high value service. If you like placing and restoring implants can absolutely be a high value service. And maybe you don't want to place implants. Maybe you have a great resource in a specialist, could be an oral surgeon or a periodontist that places the implants and then you restore them. That's another option. Maybe it's adult orthodontics, Invisalign, 6-month or liners, and maybe a short-term bracket solution like 6-month smiles. Maybe it's doing complex full mouth restorative dentistry. Maybe it's diagnosing and treating obstructive sleep apnea with appliance therapy. Pick the things you like, because if you like, and here's maybe a way to frame it. Imagine yourself taking hundreds and hundreds and hundreds of hours of postgraduate CE on that topic. What is something that you would love to learn more about where you can't wait to go to the next course to take? Naren, can you imagine that mindset where it's like you start thinking about it? Oh, in 2 weeks, I'm going to be going here to take this course from Dr. David Hornbrook in Utah about cosmetic dentistry. And you get excited about it. Well, that's a good indicator that you're on the right track for the right high value service. Now, oral conscious sedation is a little bit different than this, but it absolutely is a high value service. And I'm suggesting oral conscious sedation as opposed to IV sedation. IV sedation has a lot of hurdles you have to go through, a lot of certification process, and it may or may not be something you're interested in. If IV sedation is something you're interested in, pursue it. But oral conscious sedation is something that maybe I'd encourage any of our listeners to look into. Now, the first thing that you have to have if you're going to promote this in your practice is you have to have the skills on the shelf. You have to know what you're doing. And you want to get some education. Anytime we're dealing with the airway, we want to be educated beyond the minimum requirements. We want to be educated as much as we possibly can. There's a lot of different places to go to get educated on oral conscious sedation. But there's a particular group that I really like their entire approach. It's where we received our education. Many of my clients have as well. It's called DOCS, D-O-C-S. That's an acronym. It stands for Dental Organization for Conscious Sedation. If you'd like to learn more, Dr. Michael Silverman is the one who founded DOCS. It's a brilliant organization to support you in successfully applying oral conscious sedation in your practice. Of course, oral conscious sedation, as the name applies, means that we'll be using some kind of medicament to provide sedation. And you can get as advanced as you want on this. Many of our clients simply do level 1 anxiolysis, where they do a single dose. It's triazolam, which is a benzodiazepine. Docs recommends triazolam, so benzodiazepine. And level 1 anxiolysis would mean that you don't get exotic with it. You simply provide a single dose. You don't cocktail. You don't add, other forms of sedation with it. But it's just a single dose of sedation. And essentially, being a benzodiazepine, it provides a bit of an amnesiac. The patient's conscious; they can respond. So move to your, turn your head to the left, turn your head to the right, open wider for me. It's just that they're in kind of a twilight state. And frankly, I don't believe that any dentistry that a doctor provides is stress-free. There's always stress associated with dentistry, delivering dentistry, but this is about as close to stress-free as you're going to get, because the patient is in a twilight state. You can get up twice an hour and do hygiene checks. Patient doesn't even know you left the room. Now, you do want training on this, and I would recommend you do your training through Docs. Again, their website is docs, D-O-C-S, education.com. Peek under the tent and take a look at this. Could be a great service to add to your practice. And in what we found, not only in my office, but we found in client offices, is the type of patient that's interested in sedation is a patient that has anxiety and fear around going to the dentist. Now, let's talk about what that incident is in the population.